Good morning. So today's video is regarding how to apply a below knee cast. So definitely now a lot of many times we see that the cast is not applied properly, and so that patients have a lot of problem. Even if when you are applying a working cast, you have to be extra careful while application so that patient can work. So first step is we have to ideally should use a stockinette, and after the stockinette you apply soft roll. After application we apply a layer of felt soft roll. While applying soft roll you have to be careful that there should be overlap of at least 50%. So we see we are doing overlap of 50%. So this is the whole width and we are overlapping it 50%. So this is how we overlap. And especially you have to be careful at the edges. It should be more properly felted. I mean, the felt should be more over the edges and over the bony prominences. Like here is the bony prominence of lateral malleolus and middle malleolus, and here the felt should be more. Otherwise, this can cut through the plaster. Apply the stockinette and felt and properly applied. Although sometimes this edge should also be trimmed with scissor so that it is easy to reflect over it. So now we applied a layer of stockinette and felt, and also we have trimmed from the edges so that it is very easy to reflect while we put a cast. So now we have taken first layer of 6-inch POP. Just you have to open this roll little bit so that it is not lost in water, and you have to dip this in water at an angle. Dip it and wait for till the bubbles stop coming. Once the bubbles stop coming, then it is ready for application. Squeeze gently, give a axial squeeze. Now we start applying from distal to proximal. This is our first layer of cast. That is a simple POP gypsona cast. So generally, even applying a synthetic cast, I apply this cast so that we can mold it properly, and it's very easy while removal. Otherwise, pure synthetic cast is not very easy, little bit difficult to remove. Molding. Now I am just molding, just keeping it in the aligned position, the neutral position of the foot, and aligning it and molding. The molding is always done over the bony prominences. It is never done on the soft tissue. So the plaster should take the shape of the limb. If you can visualize the limb, that is ideal plaster. We're going to apply the first roll of synthetic cast. Again, you have to open it, dip in water, wait for the bubbles to stop, give a gentle squeeze, and start applying. While applying, go from distal to proximal, and in the ankle region, give a proper figure of 8. This is the figure of 8. And while applying, you have to just proximal edge a little bit, pull it and apply. It should be gentle, not very hard, not very loose. So that comes how much pressure you should give. It comes with experience. How much. So while applying, one more step I do is make the patient stand so that the plaster gets molded and patient will be able to walk on this plaster. So even that walking is delayed for 48 hours, but at least this standing helps in molding of the cast. Final roll. So the final roll is very important because this is the thing that is shown to the outside world, patient, everybody. So it is told that a well applied plaster cast is a hallmark of a good surgeon or a good place, good hospital. So on the edges, we should strengthen it more on the edges. Should be very careful that your plaster should not cross the felt. Otherwise, it will impinge over the skin. So that patient will have lot of trouble. So this step has to be carefully done. So this is finish it. After you finish, again same thing, mix it everything. It should be homogeneous, smooth, edges should be free, all edges are free. Ask the patient if there's कहीं भी impinge हो रहा है, कहीं भी गड़ रहा है. So it is now applied in a neutral position of the ankle is neutral. There are no sharp edges in the plaster. Hopefully, she will able to ambulate without difficulty. Thank you.